Hello. I'm so excited to see you this time because it's a great opportunity for me to speak with my viewers. So, as I promised yesterday, that today I'm going to be talking about some of the differences between cough, cold, and catarrh. And because there are some people that are just interchanging it in terms of treating these three. They don't actually know the difference between the cold, the cough, and the catarrh. So today I'm going to be talking about these three. But before then, um, I'm going to be talking about, at this juncture, I'm going to be talking about this cold before I move to cough and catarrh. All right. Some people may ask, what is the difference? Because there are some people that actually interchange it, as I said earlier, taking the drugs that they're supposed to treat catarrh, taking the drugs that they're supposed to treat cough, then they will now interchange it. All right. So it is a great opportunity for you to learn and so also to share for those that are in need of that because we are in the season. All right. Before now, as I said earlier, I'm going to be talking about the code because some people don't actually understand the meaning of this cold. So, cold is actually a viral infection, okay, primarily affecting the nose, the throat, and the sinuses. All these because all those viral infections that affect these three key things: the nose, the throat, and the sinuses. It's called cold. That is cold. And some of the symptoms or signs that you'll be able to identify or know that yes, this is cold. You see, a person will be having a runny and stuffy nose, and the person will be sneezing and having a sore throat and having a mild fatigue and mild headache. Those are the signs and symptoms of this cold. There are some people that used to be having such problems, but instead of them to be taking drugs that will cure this cold, but they will rather be taking something that maybe those drugs are used to treat cough or catarrh. You understand? So that is the difference. Before we reach to the main difference, so let's actually understand the meaning of these three: the cold, the cough, and the catarrh. And I've explained and I've defined what this cold is all about because I said it's a viral infection primarily affecting the nose, the throat, and the sinuses. And I've explained these symptoms. I've mentioned some that you'll be able to know that yes, this is cold. And what causes this cold? There are some people that may ask, but remember, from the definition or from the explanation that I just explained, that this cold is a viral infection. Meanwhile, it's caused by a virus, and this virus is called rhinovirus. That is the most common virus that causes cold, and we have another one like a coronavirus and so on and so forth. This is caused by a virus only. Cold is caused by virus only. You understand? Now, how can you know or how will you identify or understand that yes, this cold, that is the duration of this problem? You see, this cold is actually last for 7 to 10 days. Sometimes it will just come and it will go on its own. If your body system is very, very strong that can fight against that virus, it will definitely go. So, how can you treat? How can you treat this cold? As I said earlier, some people are just interchanging the medications in terms of treating this. So, and that is why today I'm going to um, list or tell you a proper way. That is the first line treatment to treat this cold. All right. Number one, under the first line treatment is just rest and be dehydrated. Sorry, rest and be hydrated, rather, not dehydrated. Rest and make sure that you are hydrated. Be taking enough fluid that will make you to be dehydrated. Okay? And also have taking some over-the-counter drugs or over-the-counter syrups like OTC decongestants. Because these over-the-counter decongestants actually, like for example, like pseudoephedrine. This pseudoephedrine actually helps in order to make sure that this cold is gone. And so also this OTC analgesic or painkillers is recommended too, because when suffering from this cold, you'll be having some, headache. Headache too will be accompanied with this cold. So for that, you will need some painkillers like acetaminophen, and this acetaminophen is also known as paracetamol because it's a painkiller. And you can still use ibuprofen, okay, that is under this OTC pain killers or over-the-counter pain killers. And so also you can use saline nasal sprays or drops. Saline nasal spray or drops, because peradventure you'll be having some, some stuffy nose if your nose is blocked. So actually, you will need this in order to have a relief. Okay, and all right, let me just advise. Okay, it's good for me to give advice. Okay, in this case, let the virus run its course. Let the virus run its course only. What I mean there is antibiotics are ineffective against a viral cold. You understand? These antibiotics are ineffective because at times you'll be having some cold, so battling with cold, then you will now be taking some antibiotics. No, let the virus run its course. Thank you very much. So please, if you have any question, any problem, you can just put it at the comment section, and by the special grace of God, I will answer your question. And please try to share to the people that are actually in need of this. Health is well. Thank you.